Hi, and welcome to the Altered Intracranial Regulation Head Trauma lecture. The objectives of this particular lecture, we're talking about head injuries, traumatic brain injuries. Basically, what we're going to be discussing is limiting it to concussions and shaken baby syndrome or abusive head trauma. So the student will be able to define concussion, shaken baby syndrome, also SBS is abbreviated, or also known as abusive head trauma or AHT. The student will be able to identify signs and symptoms of concussion and shaken baby syndrome, and the student will be able to identify ways to prevent concussion and shaken baby syndrome. Classification of head trauma, we can have open or closed. Open is skull integrity is compromised and there's a penetrating injury. Closed is the skull integrity is maintained. Further classification, we can classify it as a mild, moderate, or severe, and the classification is dependent on the findings on the Glasgow Coma Scale, which we're all familiar with, and how long the patient has been unconscious. In the U.S., it is estimated that 1.1 million persons are treated and released for TBIs, which is short for traumatic brain injury, from the ER. Approximately 50,000 deaths occur annually from TBIs, and 5.3 million Americans are living with disabilities related to TBIs. So, types of head injuries. There are scalp lacerations, skull fractures, which may be closed or open fracture, diffuse injury, concussion, which is what we're going to discuss today, diffuse axonal injury, which we further discussed with SBS, and focal injuries, contusions, and coup, counter-coup. Complications, epidural hematoma, which is bleeding between the dura and inner surface of the skull, a subdural hematoma, which is bleeding between the dura mater and the arachnoid layer of the meninges, and intracerebral hematoma, which is bleeding within the brain tissue. The most common type of head injury is a concussion. It is a sudden, transient, mechanical head injury that disrupts the neural activity in the brain. It is caused by a bump, blow, or jolt to the head, and it results in loss of awareness or responsiveness for a short period of time. And the reason that we're discussing this in this particular course is that we see a lot of head injuries in pediatrics, a lot of concussions. In particular, when you're working in the school beside the school nurse, you will see a lot of students come in with injuries that they may have occurred while they were playing sports or while they were on the playground. So assessment findings and symptoms of concussion. The physical, the person will complain of a headache, oftentimes maybe fuzzy and blurry vision. They may have nausea and vomiting early on. They may have dizziness, sensitivity to noise or light. They may experience some balance problems, and they may feel tired or have no energy. There is also signs and symptoms related to emotion or mood. They may be irritable, they may have sadness, they may be more emotional, and they may have nervousness or anxiety. Other signs and symptoms that they may have could be related to thinking and remembering. They may have difficulty thinking clearly. They may be feeling slowed down, they have difficulty concentrating, and difficulty remembering new information. Sleep disturbances, symptoms. They may sleep more than usual or sleep less than usual and have trouble falling asleep. So they can have symptoms that linger. Post-concussion syndrome can develop in some patients and can be seen anywhere from 2 weeks to 2 months after injury. Those symptoms include persistent headache, lethargy, personality changes, shortened attention span, decreased short memory, and changes in intellectual ability. Danger signs that occur when a concussion is suspected is that a headache gets worse and does not go away, that there is some weakness, numbness, or decreased coordination, repeated nausea or vomiting, slurred speech, These symptoms may be due to a complication of an epidural, subdural, or intracerebral bleed and is related to increased intracranial pressure. This requires immediate medical attention. Shaken baby syndrome, also known as abusive head trauma. This is a result of violently shaking an infant by the shoulders, arms, or legs. Shaken baby syndrome may result from both shaking alone or from impact. The resulting whiplash effect can cause bleeding within the brain or the eyes. It often results in a diffuse axonal injury, or DAI, or contusions in the baby's brain. Here's an example of infant rotational acceleration injury with axon shearing. And as you can see, the baby doesn't have enough support in the neck. In the head, the brain is moving about within the brain, causing injury and axonal shearing of the axons. So signs and symptoms or assessment findings with infant with SBS, shaken baby syndrome or head injury. Less severe symptoms would be changing in sleeping pattern or inability to be awakened, vomiting, convulsions, irritability, uncontrolled crying, inability to be consoled, inability to nurse or eat. Severe symptoms include unresponsiveness, loss of consciousness, breathing problems, irregular breathing or not breathing, and no pulse. Long-term effects from shaken baby syndrome or traumatic brain injury: blindness, mental retardation or developmental delays, cerebral palsy, severe motor dysfunction, spasticity, seizures, and death. Interventions with a traumatic brain injury, shaken baby syndrome included. The goal is to maintain cerebral oxygenation and perfusion. The interventions are neurological assessments at periodic intervals based on findings from the Glasgow Coma Scale. We want to report abnormal findings to physician and teach prevention of head injuries. Prevention include, and this is a big part of what we do as nurses, teaching the parent that buckling the child in the car, using child safety seat, such as booster seats or seat belts according to the child's height, weight, and age, wearing a seat belt every time that you drive or ride in a motor vehicle, and never drive under the influence of alcohol or drugs. Preventing concussions, also wearing a helmet, making sure that children wear helmets when riding a bicycle, motorcycle, snowmobile, scooter, or all-terrain vehicle. Wear a helmet when they're playing a contact sport such as football, ice hockey, and boxing, or when they're using inline skates or riding a skateboard, when they're batting and running bases in baseball and softball, when they're riding a horse, when they're skiing or snowmobiling. Other preventions is making living areas safer for children by installing window guards to keep children from falling out of the windows, using safety gates at the top and bottom of stairs, making sure the surface of your child's playground is made of shock-absorbing materials such as hardwood mulch or sand. Children are not the only ones susceptible to head injuries. Also, seniors, other people are, everybody is actually, but to prevent injuries with seniors, we want to remove tripping hazards such as throw rugs and clutter in walkways, use non-slip mats in the bathtub or shower, install grab bars next to toilets and in shower or tub, install handrails on both sides of the stairways, improve lighting, and maintain regular physical activity to improve balance, strength, and coordination. So prevention and management of concussion in sports, action plan. What needs to be done is they remove the athlete from play. We want to ensure that the athlete is evaluated by a healthcare professional experienced in evaluating concussions. Inform the athlete's parent or guardian about the possible concussion and give them the fact sheet on concussions. Keep the athlete out of play on the day of injury and until a healthcare professional experienced in evaluating concussions says that they are symptom-free and able to return to play. What most schools are utilizing is IMPACT, which is Immediate Post-Concussion Assessment and Cognitive Testing. It is the most widely used and most scientifically validated computerized concussion evaluation system. IMPACT provides trained clinicians with neurocognitive assessment tools and services that have been medically accepted as state-of-the-art best practices as part of determining safe return to play decisions. And you will see this in most public education and public schools nationwide being utilized. Here's the website, https://www.impacttest.com, and that will give you more explanation on it, but also I think gives you sample testing. So the IMPACT concussion management model, it is basically step one. They do a preseason baseline testing and education. So the player will do a pretest to see where they are at cognitively. Then post two, if they get to step two rather, it will be a concussion is suspected. So step three will be post-injury test and treatment plan. Step four is the athlete ready for a non-contact activity? And step five, determining safe return to play. Risk for SBS, which is shaken baby syndrome. This is something that you need to determine with parents. Having unrealistic expectations about child development and child rearing. Prematurity or multiple births. Infants less than 6 months. A child who is inconsolably crying. A parent or caregiver who has been abused or neglected as a child. Someone who is being a victim or witness to domestic violence, and being a single parent. So those are some of the identifying factors as a nurse that you need to be aware of. Prevention, what you can teach or prevent from a parent from causing shaken baby syndrome, is telling them to rub the baby's back, gently rocking, offering a pacifier, singing or talking, taking a walk using a stroller or drive with a properly secure safety car seat, and put the baby on his back or back in the crib. Walk away, call a friend, relative, neighbor, parent, and check in on the baby every 5 to 10 minutes. You want to encourage new parents to express concerns and frustrations with healthcare professionals. Help teach coping strategies to parents or caregivers if becoming frustrated or angry with the child. Reinforce prevention through helping parents and caregivers understand the dangers of violently shaking the baby. Encourage parents to ask for help from family and friends and healthcare providers or social service agency if the frustration feels overwhelming. One of the things that's very important to teach a parent is the acronym. It falls under the acronym PURPLE, and this is teaching parents. The first P is peak pattern. Crying peaks around 2 months and then decreases. Unpredictable. The crying for long periods can come and go for no reasons. The R is resistant to soothing. The baby may keep crying for long periods. The P is pain. It's pain-like look on the baby's face. The L is for long bouts of crying. Crying can go on for hours. And the E is for evening crying. Babies cry more in the afternoon and evening. So these are some of the things and signs and symptoms and preventative ways of treating someone with concussion and or potential head injury for those with abusive head trauma or SBS.